Hey guys, it's Dr. Anthony Barta here at Brown Chiropractic. This video we're going to be talking about some things you can do to help out tightness through the neck and upper back area, which I know a lot of us deal with throughout our day-to-day lives. A lot of time spent on our phones, our computers, especially if you have a job where you're working at a computer all day. It can cause a lot of pain and tightness through your neck, which just leads to discomfort in that area and can even start causing headaches and way down the line, potentially stuff going down your arms. So a couple stretches that we can do to help loosen those muscles up, and then we're going to end with an exercise as well to help strengthen the area and help stabilize things. So first couple stretches you can do sitting in a chair, or you can do them standing. The main thing you want to focus on is keeping your shoulder down while you're doing the stretch. So if that means you're sitting on your hand or grabbing on the edge of a chair, I oftentimes, because I'll do it while I'm standing, just like to put my hand behind my back, which helps keep my shoulder locked in that downward position. And you're just going to grab the side of your head and pull away from that shoulder as far as you can comfortably. And just with all our other stretches, we're going to be holding this for 20 seconds all the way up to a minute, whatever you're comfortable with. Come out of that stretch, and you want to make sure you're doing both sides, obviously. So pull away from that shoulder that you're forcing down, and then get a good hold. That's going to stretch the muscle up here at the top of your shoulder called your upper trap or trapezius. This next stretch will focus more on a muscle called the levator. It attaches to the upper shoulder blade back here. So if you're feeling like your pain or tightness is more on kind of your upper back or upper shoulder blade area, this one might be better for you. So same thing, you're going to keep that shoulder down with whatever method you like. And then instead of pulling straight to the side, you're actually going to turn your head maybe about 45 degrees, and then you're going to grab the back of your head and pull your chin and your nose kind of down at an angle, kind of towards your armpit. So again, pull as far as you can comfortably, and just like with all the other stretches, holding it for 20 seconds all the way up to a minute. And again, make sure we're doing both sides like that. Super simple. You can do these almost anywhere. And again, really throughout the day, as much as you feel like is necessary. I try for a couple times per day, but if you're noticing the tightness, just go ahead and stop what you're doing and do those stretches. It'll be a great way for you to break up the monotony of you sitting at your desk all day. This next stretch is going to be used to stretch the muscle called the SCM, also known as the sternocleidomastoid. It's right here on the front of your neck on both sides. If you turn your head to the side, you can see that muscle pop out like that. That right there is your SCM. This one can become tight oftentimes with a condition known as torticollis, which we see in infants all the way up to adults as well. It's more common in infants, but it's also more common with drastic weather changes. We oftentimes see people coming in with tightness around the front of the neck, especially when we get into these colder weather months. So make sure you're keeping that neck covered up with a scarf when you're going out in the cold weather. But to stretch this muscle, again, we're going to keep that shoulder down. You're going to look away from the side that you want to stretch and then look up. So it looks like this. Look away and then look up. And it helps if you keep your jaw and your mouth closed. If you let your jaw go slack and open your mouth like that, it's not going to allow that muscle to stretch as much. So make sure you're not necessarily clenching your jaw, but just make sure you keep your mouth closed. And you're going to feel a lot more of a stretch than if you let it just hang open. And then if you need even more of a stretch, you want to make it more intense. When you're up in that position, you'll just kind of grab up here by your collarbone and hold that down, because that's where that muscle attaches, right there at the corner of your collarbone, right next to your sternum there. Just like that. It's a really simple stretch. Again, 20-30 second hold. Make sure you're doing both sides. Turn away, look up, hold that down if you need to, and keep your mouth closed. You can even kind of jut your jaw out if you want to intensify it like that. It makes me feel a little bit more of a stretch. But that's a great way to stretch these muscles here on the front of your neck. So this next movement we're going to be doing is actually more of an exercise. It's going to be used to strengthen some of the muscles around the neck. It's kind of a postural exercise. So if posture is something you're concerned with that forward head, kind of rounded shoulder posture, this can help with that. It can also help alleviate any neck pain or tightness that you have. And even personally, I use it when I have a headache. I do this and it helps alleviate some of that pain I have from a headache. So it's a great exercise to do really for just general neck health. It's called a chin tuck. It's a very simple and subtle movement. So you're not going to be going through a very wide range of motion. I'm going to turn to the side here and show you what it looks like, because that's going to allow you to see the range of motion better. But you can do this either seated or standing. You just want to make sure that you're starting out in a position of good posture, so we're not starting like this. So make sure we're sitting up or standing up nice and tall with your shoulders back. And then I like to put my finger on my chin just to give me an idea of where that motion is coming from, kind of as a cue. But you're going to sit up nice and tall, and you're just pushing your head towards the wall behind you. So we're starting here, and we're going there. So it's not a lot of movement. I'm not going to talk to you while I'm in that position, because you'll find it hard to talk. You're kind of closing off everything in your neck there. But you're going to squeeze back into that position and hold it for 10 seconds. Then you can relax, shake it out, do whatever you need to do. Maybe rest for a few seconds, and then squeeze it back again for another 10-second hold. And you're squeezing these muscles tight. And you'll do that for 5 repetitions. So again, it looks like this, sitting up nice and tall. Without the cue, you're just going to go like this. Now, a couple things this is not. When we say chin tuck, a lot of times people think we're doing this. It's not that. We don't want to be looking up like that, and we don't want to be shrugging our shoulders up like this. So it's literally just your head moving backward towards the wall behind you. You'll probably feel some tightness or a pulling sensation in the back of your neck, especially closer to the base of your skull, because this is kind of stretching those muscles out when you do it. So this exercise is strengthening these muscles that are deep within our neck, our deep neck flexors that are chronically weak and underused. And in doing so, it's going to allow the muscles on the back of the head to stretch out. So you're pulling your neck back into a more natural curved position, strengthening muscles and stretching muscles simultaneously. So it's a great exercise, and you can do it almost anywhere. If you have an issue with your neck that is very acute and painful, and you can't see yourself pulling your head and your neck through these ranges of motion, or even doing a chin tuck like that, a good place to start is simply by getting some very light, gentle motion in your neck. And you can do this just by going through your neck ranges of motion. So what that means is your head and neck can turn left and right. You can look up and down, and you can tilt left and right. So what you'll do is simply turn and look as far as you can comfortably. Obviously, I can go way over there, no problem. But if things are very, very tight or very painful for you, for whatever reason, simply start by turning as far as you can comfortably. Don't push into any, pain that causes you to wince. Turn as far as you can and hold that position for about 10 seconds. Then you'll go the opposite way. Hold it for about 10 seconds. Again, you're going as far as you can comfortably. No pain here. We're talking about a very acute, painful situation again, so you don't want to be aggravating things and making it worse. After you turn, obviously you're going to look up as far as you can comfortably. Hold it for about 10 seconds. Down as far as you can comfortably, about a 10-second hold. To the side, to the side. Again, if your range of motion is only allowing you to go here, 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 like that, that's fine. Any amount of kind of testing those boundaries of ranges of motion that are comfortable for you will help to increase that range of motion and loosen things up a little bit to make you that much more comfortable. So these stretches and that one exercise are a great way for you to help reduce any pain and tightness that you might be experiencing, as well as to help prevent any issues from occurring in the first place. I would recommend that you probably just make these a part of your day that you do. Make it a consistent thing that you do on a daily basis to help prevent any issues from arising. If you do find yourself in a situation where the pain and tightness just doesn't seem to be going away, or if it's a very acute situation, like I said, to where you're not even able to go through a very wide range of motion, it's going to be best to go ahead and call us and get in for an appointment so we can do a quick exam and help to loosen things up with the tools we have in our office to help get you back on track to being pain-free. I don't know. Being in a, no, I don't want to say that. Hold on. Thanks for watching the video. This is the part where I tell you to comment something, ask us questions. We love answering questions. Like the video if you would, we'd appreciate that. And subscribe to our channel so you don't miss out on any future videos where we walk you through things that can help you in your day-to-day life.